Welcome to Athlete's Edge with Doc Dolly.
Smith grabs the puck and scores!
Providing athletes with a scientific edge in achieving goals and optimizing performance, we bring in expert healthcare practitioners and high-performing athletes to share case studies, cutting-edge research, and their invaluable knowledge.
Had him dead to rights. McDonough cross. They score! Nikita Kucherov!
Whether you're looking to enhance your training, prevent injuries, or reach new heights in your sport, you're in the right place. Let's introduce your host, from Rhinelander, Wisconsin, former collegiate athlete and owner of Motivation Health and Wellness, Dr. Jayson Dahlquist.
They score! It goes in!
Welcome back to another podcast. My name is Dr. Jayson. I am here with a mentor of mine from the physical therapy perspective. She was actually my last clinical instructor, one of the most important ones, because it led me down a rabbit hole of PT entrepreneurship. And I want to welcome Dr. Antonia Counts to the podcast. And we are going to really dive into what athletes are missing in normal physical therapy practices, whether it's rehab, preventative care. There's so much that we can dive into from the physical therapy perspective that people don't understand. So that's what I really want to get into. I'll let Dr. Toni here kind of introduce herself. She's got two different practices. She's working on so many different things right now. So fill us in on where you're at right now with your practice.
Yeah, so we have been Off the Block is the name of my practice. It's been open for a little over 3 years now. I started mobile. It was just me and a table in the back of my car. And then we transitioned into a CrossFit gym for about a year. And then we opened our own standalone location and then opened location number 2. So we've got 2 staff clinicians now, a nutrition coach on staff, and then myself. And I still practice some, and then I help run our business. And my husband Cole actually also helps me run our business. He does all the background stuff, the finances, communication, that kind of stuff. So that's where the practice is at. I've also made a little bit of a shift as of late because I really enjoy mentorship, and I really enjoy kind of being the change that I want to see in physical therapy as a whole. And kind of a unique way that I'm getting to do that right now is actually working for the mentorship program that Jayson and I are both a part of, PT Biz, and I am helping there, being a business advisor and just helping other cash-based practice and performance clinicians get up and running, because long term, I would love to see performance and cash-based PT just put insurance-based PT out of business. I think it'll always be around because there's always going to be people who are looking for the cheap way out. But all that being said, it allows me to have a little bit more impact in the greater PT community. So that's what we're doing right now. It's been super fun. But thanks for having me on. I really appreciate it.
Yeah, this is so great to reconnect. Dr. Toni, you got me started on 75 hard. They just brought it up in my PT accountability meeting within PT Biz, and I was lost after like week 2, or not even week 2. I was lost after like day 2. I was like, there's no way with all of the things that are going on in my personal life and starting the business that I can handle all of this. I was just so stressed out after like day 2 because it's a lot. Like there's so much that you need to do when you first get going. And I was thinking too, because you brought up Cole, and I was like, man, to have a Cole on my staff right now would be like huge.
Yeah.
There's so much that he does in the background. And when I was there as a student, I was like, man, having an admin staff that is as good as Cole, I was like, I need that. That's what I need. But to gear this, go ahead.
Okay. I was just going to say, it's definitely one of the best first hires you will make as far as transitioning and being able to continue to provide that like excellent level of clinical care. So for sure.
But to really switch the gear here to more of helping athletes, what is the number one thing that we do as physical therapists, that speaking from more of the preventative and like athlete performance side, that we can do now with our scope of practice being out of network, performance physical therapists, that you were not able to do? Because you worked at, was it ATI before you
No,
switched?
it was a more local place. It's similar to ATI, but
Okay.
they're still more local, but high volume insurance based clinic type model. Yeah.
Mhm. Yeah, so kind of break us down with that.
Yeah, I think there's a couple of unique things that we have the opportunity to do in the cash-based performance world that is very different. First of all, I think some of it is as simple as like you walk into the clinic, and if you walk into an insurance-based clinic, chances are, and they're not all like this, but chances are you're going to walk in, and the heaviest thing that you're going to find might be a 10-pound kettlebell, or a pair of 10-pound dumbbells or something like that. You definitely, more than likely, you're not going to find a barbell. You're not going to find wall balls. You're not going to find a GHD machine. You may not even find, a treadmill that's set up appropriately for like a gait analysis or those kinds of things. So I think some of it is just simply the time that we have in a one-on-one model where we can dig deeper and assess more specifically what it is that athlete needs to be able to do to perform their sport. And in order to do that, you have to have the equipment to do that. So I think some of it is just taking the greater like data that's been collected over the last several years and the research that backs loading people appropriately, challenging their systems appropriately, and then having the equipment in the clinic to actually test and train those things. So I think that's a huge leverageable piece that we get in the cash model and the performance model, because we have the time, we have the equipment, and we have the expertise to actually dig deeper into the facets of people's sports that are different. So for example, I just recently saw an NFL player, and he plays for the Rams, and he's actually a local guy, which has been super cool because he like grew up near us and played in the high school near us, and now
It's
he's
crazy
yeah. Oh,
being from a
it's
small
awesome.
town like
Yeah.
Central and Easley, that like how many people roll through there. Like I'll say,
Right.
I'll
Right.
meet people up here now, and I'm like, what? You're
Yeah.
from there? Like even
Yeah.
Greenville right down the road?
Hmm.
It's crazy how big that area is, even though it's small.
Right, exactly. So it's been cool to even talk to Cam about his journey to making it to the NFL. But he came to see us in his off season, and he was dealing with like a turf toe related injury, right? And
Okay.
so his doctor, that like the local orthopedic, sent him to an ATI, and he was there for a couple of weeks, right? And he was like, "Yeah, I was laying on a table, between two like 80-year-olds, and they would like massage my foot some and put a TENS unit on it. And then I would like get a little yellow band and kind of work on like, pointing my toes and stuff like that." And he's like, it just didn't really feel like it was changing anything. Like, after a little bit of motion, it felt better for half an hour, but nothing felt like it was changing. So
Hmm.
and then he was like, so I was talking to my friend who was training me in my off season, and he mentioned that I should come see you. And so brought him in, of course, like did some dry needling work, did a gait assessment on him because, taking off from his stance position and running was one of the more difficult things he was experiencing pain with. He said he felt like he was lacking power because of that. He wasn't able to be as fast, definitely couldn't like jump or anything without discomfort. So just being able to dig into the facets of like what is required of a football player, especially a cornerback, which is a position that he plays. So like there was so much more detail that we were able to go into. And then like we just didn't spend a lot of time like doing manual therapy on the table, because that's not what's indicated when you're dealing with like sesamoiditis, great toe extension based injury. But we had the time and we had the equipment, and like we loaded up a hex bar and had him do jumping drills once we got the pain to calm down, and we reassessed his gait because that was a major issue. And we looked at a lot of challenging things where we were having him throw a football while we worked on balance work, because at some point we needed to integrate strength and sports specific stuff together just in order for him to even be ready to be sent back to his trainers in LA. So those kinds of things. Now, honestly, that's a rarer situation and on a much greater scale than a lot
Right.
of the athletes that we see. But from that kind of perspective, being able to just break, like, because football isn't just running, and football isn't just power production, and football isn't just skill and those kinds of things. It's all of those things together. So having the time and the equipment and the capacity to break all of that down and treat him specifically the way it needed to be treated, I think is transformational in what PT can be.
Yeah, and a large part of it does come back to equipment. It does
Mm-hmm.
come back to how much time we spend with people, and just the attention, the ability. So we don't see nearly as many people in the performance space. Out of network physical therapy is what you do in an insurance, as from the provider's perspective.
Mm-hmm.
So I have time in my day to do research, to do prep work. They don't.
Right.
And they're not going to do it outside of it. I guarantee you that. No chance are they doing it out. I didn't. When I worked as a PTA since 2018 before I got my doctorate, and I wasn't doing anything. I was burnt out. I was toast. And when like afternoon came around, I was like, I don't even want to see the last 6 patients on my schedule. And I was only one-on-one. But that's like you have to do notes for every single one of the people. So you're doing 10 to 12 was like the max usually that I saw. But if everybody was 30-minute appointments, that's a lot of people in a day. And a lot of documentation, and you're switching gears nonstop. And for the people in the last like 4-hour section of my 8-hour day, I was like, I feel bad for you because my brain is not here.
Yeah.
And now it's somebody comes in, it's like I'll keep people a little bit extra because they got questions that need to be answered. And like you just have so much time that you can give and energy to on top of it to these people. I want to come back around. What do you use to record gait analysis? You brought up like the power takeoff with Cam.
Yeah.
What do you use?
So I will say it depends on the athlete. We've used the Huddle app a good bit at one point because it allowed us to slow things down and look at angles and impact and some of that kind of stuff. We actually, which this isn't a gait analysis thing, but it is something we're hoping to incorporate with athletes. We're looking at getting some Vald force plates to start to look at like jump and absorption and all of that kind of stuff. So that is something we're looking to incorporate. I will say our gait analysis stuff could definitely be higher tech. But a lot of times, like even just not just saying, oh, let me watch you walk or, oh, let me watch you run, but spending the time to record from a couple of different angles and to go back and slow things down and screenshot like, hey, do you see your hip drop here? Do you see your foot pronate there? Or whatever the case may be. That's more assessment just in the 3 to 5 extra minutes it takes you to throw them on the treadmill for a second than they've ever had in their lives. And it's such an important part of their sport. And then if it's like a runner, spend a little extra time, you maybe like record at different cadences, you play around with stride length and all that kind of stuff. So you can definitely dig deeper if that is the primary part of their sport. But I think sometimes we forget that most field sport athletes are spending their whole time running, and we totally leave that out. So like a gait analysis in and of itself, like I said, is more information and data collected than they've had at any other rehab experience. And then being able to go back and reassess later, like that is huge for a lot of people. They can see a lot of the changes take place, and it's just good data to collect. Because at the end of the day, if you don't track it, you can't change it. That's true of business. That's true of people. And I'm not saying that every little thing, every little objective measure is super meaningful, but that's another thing that we get to do with patients is show them the data of this is where you started. That 3 to 5 good data points for where they started that actually will allow them to track and measure their progress in ways other than just how's their pain feeling, and then showing it to them a couple of times throughout a plan of care. I think it makes a huge difference for buy-in. I think it provides a massive amount of value for, even just them understanding what's going on with their body going forward. There's just a lot of obviously value in the data, but you might could get nerdy about that for sure.
Oh, absolutely. I have a DSLR camera, which is what I have recording right now. I use it for all slow motion. Does 1080p, which is super crispy on this type of a camera, and that's what I record my gait analysis with, and then I slow it down on an iPad that I use for all of my editing content. And you can see so much with that. And that's what I use. You have the technology, you have the time to edit it and give it people what they need to really see these objective measures and what really matters out in a sport or like whether they're on the pitch for soccer, football field, ice rink, whatever the case is, they need to know what they're doing there, because that's where it matters. It doesn't matter here on the table doing some leg extensions. Yeah, it's great for a starting point, but I just gave a presentation, did a workshop at Anytime Fitness, and everybody was late 40s and older. I was like, you guys need to load. Like, you need to do a lot more than what you're doing. You don't do enough. And this is where the education points us to. But that's really what it comes down to, is our education is different than what theirs is in the other clinic. Like, we are trained because that's what we study, and that's what we work with, is the active population and how to get them at a higher level back to what they need to do. And they don't know how to do that. They're almost two separate practices. Like, they're set up to work with every joint replacement from a 50-year-old to a 100-year-old. And it's like, well, we don't have a lot of that equipment because it's too low level.
Right. And I think something else that's interesting that goes along with the data is it definitely shows them, important points of performance, but it also shows, like, a lot of the data that we collect it because it indicates, risk of re-injury and some of the more preventative measures, which is another super unique thing that we in the out-of-network or cash-based model get the opportunity to do with people. Like, healthcare nowadays, it's practically a sick care system at this point, but because we have the freedom to be outside the realms of insurance, we get to be preventative with people. So we can even show them, like, yeah, sure, your pain is gone. Yeah, sure, we're starting to reverse engineer the root cause of the problem here. But at the same time, you still have XYZ weakness that is X% below what the average athlete that's playing your sport at your age and your level is doing. And that means that you're still at risk of tearing your ACL or your rotator cuff or your, ulnar ligament, whatever the case may be. So I think it's really cool because even then we can go beyond just like getting people back to baseline, which is like the common thing that a lot of people, the common phrase that a lot of in-network clinicians use. Oh, back to baseline, you'll be so much better. I'm like, no, back to baseline is bullshit. That's where people got hurt. Why would I want you there? But I can show them then that their baseline, number one, is why they got hurt, and why working then preventatively or to build like resilience and build total ability to maintain or to grow in their sports performance is actually crucial for making sure I don't ever have to actually see them for rehab again unless it's some crazy traumatic thing. So there's just good stuff there with the data that even goes beyond the performance side. So it's just another level of value I think we get to provide.
Absolutely. There's a little tidbit that I wanted to touch more on in there, and it's about getting people back to baseline. And that's what insurance cares about. They're like, oh, well, you were functional before there was a problem, so we only want to get you back to this. Anything else after that, it's on you.
Right.
So they're not even better off going to those places anyways. Like, you're getting the very low level of care. And most of the time, if you just follow the basic recommendations that you find on Google today, so not the Rice principle anymore, but low levels of movement that's not pain, the body's going to just respond well with that.
Right.
And it's like, okay, then you're going to get back to your baseline. But once you go back to whatever activity that you were doing before, you're going to get injured again because you didn't fix a problem that caused the injury in the first place, or the deficiencies that you have, muscles, bones, tendons, ligaments, whatever the case is, that cause a problem. And this can be any age of life. An active athlete that's in college or down to youth or even up into the geriatric population. And it's so cool that we can provide what they actually need. And it's as simple as we just don't work with insurance.
Right. Absolutely. It makes a massive difference. And that's what I, was kind of alluding to there with the whole like sick care system. Like, as I feel like in network clinics, and this is not a testament to the clinicians that are that feel stuck in those clinics. I know lots of great physical therapists who, unfortunately, just because there's way more of these types of jobs available, are kind of stuck in an in-network model, and they do their best. They really do. Most of them. Some of them become a little compliant or complacent with the mediocrity that comes with the type of care that you can provide in those models. But a lot of them are doing the best they can, but it's the model. It's run like a business. And I'm not saying that my business isn't run like a business. Like, we do track revenue numbers and those kinds of things, but it is not about how many patients can I cram into a caseload and how burnt out can I leave my PT at the end of the day, but they just keep coming back because they want a paycheck. Right. It is about the quality of the care. And so it's terrible that our healthcare system is being run like a business. And so many people still think that, oh, well, if my doctor told me this, then they must have my best interest in mind. And it's like, well, if you're a surgeon and you're holding a scalpel in your hand, then you're going to be like, oh yeah, it's totally surgical, because that's where they make their money. And again, not to say that every surgeon is like that, but there are a lot of those out there. So at the end of the day, running your business from a patient-forward perspective and allowing it to be driven by the better solution that we get to offer people versus the amount of revenue that we're going to generate off of, the next person that comes in the door, it's a massive mindset shift, and it allows us to be the change we want to see in the healthcare field. But it's huge, because being out of network is what allows us to do that.
Right. Yeah, it's so crazy, because when you bring about the provider's perspective, you're always worried about, how am I going to bill for this? And not, what does the patient need?
Right.
Because that's always going through your mind. It's like, okay, this is manual therapy. I need to know how many minutes I'm doing this for so I can bill for it. And if it's in the plan and I started doing it, I got to at least do it for 8 minutes.
Right.
And
that's why the timers are such a big thing in like, the in-network clinics. Like, I feel like when I finally was able to quit the clinic, I still heard beeping in the back of my brain for like a year afterwards. It was like beep, 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 beep. And I was like, oh, but that's why we had to do all that stuff. It's like, oh, well, 8.5 minutes, I can like count that as a unit and move on.
Yep.
Oh, worse.
That's ridiculous. And imagine having multiple patients at the same time. And how that's even possible. You take a really good clinician, you put them in that model, and they are automatically boxed in. You will not allow them to reach their potential with patients or their potential as a clinician, especially because there's so many of them. They're knocking on the door to get in. It's like, when are you going to treat an athlete? When are you going to educate people on what they can really get to and what really matters, like your nutrition, your sleep, all of the core factors that keep people healthy and performing optimally at whatever they're doing. You can't. There's not enough time, and insurance isn't going to bill or like reimburse for that. Like,
absolutely
no way. I gave a presentation, which we talked about this too back in, I don't know, it's like a year ago that I was there. Yeah. But the younger you with Dr. Kara Fitzgerald and the core aspects that you really need to do to perform and just live a healthier life, not age at a slower rate biologically, or age at a faster rate biologically than what you are chronologically. So like your cells are functioning slower and worse in most adults, even looking into like the late 30s. I've been seeing more chronic patients when I was going through clinical rotations than I've ever seen in my life, like younger than me. So they're 25, 26, and they've been in pain for long periods of time. You look at lifestyle factors, boom, fix those, and then come back and talk to me. You know what I mean? It's like there's only so much you can do just in PT as a whole. But if you don't talk about those real problems, we're doing a disservice to our patients in the community. And they don't even allow for that. But I guarantee you, to bring it back to Cam, being an NFL athlete, he's not doing all the extra crap. There's no way. There's no time in his day for him to perform as a top-tier athlete and get to where he's at if he's eating Townhouse crackers and that's his only meal of the day.
Yeah,
And you laugh,
absolutely.
but that's one of my patients. She was super stressed out, not sleeping at all, taking care of her mom. Doesn't do anything for her, but she'll go out and play volleyball like once a week in just severe amounts of pain. And like all she eats is Townhouse crackers, and then she'll have some alcohol here and there. So like severe dehydration's going through my mind. All of
Yeah,
the basic things. You got to do the basic things right. But again, if you don't
right.
talk to them about it, you don't get results.
Yeah. And a lot of times we're the first people that bring that up with them. Like they may have seen a PCP and the PCP just hears, oh, pain, related with when I'm playing volleyball, and they're like, PT. So, even though I feel like a lot of times that should be the primary care physician's job, a lot of times we're the first time they hear it, and sometimes we're the only time they hear it, which is crazy. And of course, there's there are limitations within our scope of practice as far as like how far we can go with advising people on those things. But there's also a huge opportunity just to educate. Hey, just so you know, these factors play a role in your pain experience, in your
Yes.
body's inflammatory response, in all of these things. And it may be worth it may be worth you seeking out additional counsel on how to manage these things going forward, because who's to say that we couldn't fix all of the mechanical reasons why your body is hurting and you still might be experiencing pain simply because we haven't resolved the rest of the problem.
Yeah. And the whole psychosomatic version of pain as well.
Yeah.
We have not gotten to a time yet, like mentally, where it's okay to, or like sought out to go see a psychologist. It's like I just had a conversation with a sports psychologist a couple weeks ago that I put on the podcast. It was the first episode, and like everybody should be seeing one. When you want to talk about performance, have in your mind, and like especially when you talk about recovering from injuries, I said the same thing with her. We don't, in our profession as physical therapists, tap into the psychological aspect of healing as much as what we need to. But it's not, we're not that educated on it. So any education and good clinician that does tap into it, they've read a lot of books and they've done a lot of continuing education. Or we just need to say, hey, I've got this person. She does pretty much exactly what I do. You need to call her because she is going to help you probably more than what I can. But while we work on our physical side of things, and we don't have good networks unless we establish them. Like what you have, you're building the network in your area, which is great, and you've got nutritionists on staff. You're got a pelvic floor therapist too now, right?
Yep, pelvic floor PT. And it's actually funny that you mentioned the sports psychology side of things. So I had a parent reach out to me earlier this week for a 17-year-old baseball player, and we've helped him navigate 3 seasons with different injuries now. And it's starting to take a toll on him, right? Like he wants to play in college and he wants to be able to do that, but he hasn't had a healthy high school season yet. And so we're going into season, hopefully in the spring, and finishing up navigating some knee pain that he's having. And his mom reached out to me the other day and was like, hey, I think we need to take into consideration the psychological side of this, which is something I actually mentioned to him earlier this week. She said, do you have any references? And I've been reaching out to some other counselors and psychologists in the area, and they've pointed me in a couple directions, but I actually have a new patient who is a runner. She's training for the Tokyo Marathon right now. Ooh. And she is a mindset coach. And so I'm gonna offer the mom a couple of options, because they're, clinical psychology, I think, is definitely a good way to go. But this particular coach also does a lot of mindset training and helping people like recover mentally from the challenges of injury and getting back into sports. So I think having like both ends of the spectrum, because I think it's tough too. I'm leaning towards maybe even encouraging them to see the mindset coach who's also an athlete, simply because she understands the grueling effort and she's navigating some injury herself right now in this, which is why we're treating her. But she gets it. She is an athlete. She's training for something really challenging. She's dealing with injury. And I think even just the ability to relate to him on a more personal level. Because I mean, you're going to run into a sports psychologist who they've probably played sports if they're into sports psychology, but there's the uniqueness of being able to relate to that person for that reason. So, I think those are absolutely crucial connections that we make with our community, but it definitely isn't leveraged enough right now.
Right. Yeah, it's interesting that you bring up the aspect of training for something. That is in the insurance PT realm, in network realm. I would say probably 80% of the patients, maybe even more than that, they're not working towards anything.
No.
They're just, I'm in pain. I was told to come here because that's what pain management told me to do. And that's it. Like, well, what do you want to get out of pain for something specific? And they're pretty much like, no, I just want to be out of pain. I'm not sure what you can do for me. I'm not sure why I'm here. I've got no real physical active goals. I'm not healthy by any means. And really the important factors of working towards something, they're not there. That mindset, they're not. That's tough to help somebody that doesn't really even have a physical goal when we're trying to help them out of some sort of physical pain. It's like, well,
absolutely.
what's the end goal? Just to get out of pain? Well, we can give you some medications, but it's going to take some movement to actually fix any sort of problems. But if you don't want to do that, then I guess I'm not sure how I can help you. And we can have those conversations with people that come in here, and over there I'd get yelled at if I push somebody away from physical therapy because it wasn't the right fit, or at least not the right fit at the right time. But then having that network that we can tie things back into, because sometimes they need to see somebody in the psychological realm because life factors are not where they need to be. And that can play a huge role in what we do. But if we don't recommend them to go to the right place to get the help they need right now, they're not going to get good results either.
Right. And that starts to reflect on your practice as a whole, right? Like if you bring someone in who's not even ready to get better, then their perception of what physical therapy did for them is going to be all sorts of off. So it's almost like a screening process at this point. But it also helps us, like you said, it helps us direct our care towards the people who are actually in a place where they're ready to accept the challenge. Like the idea of leading a horse to water and providing all of this education, because that's the other unique part of cash-based physical therapy is we're not just helping you navigate injury so that you can get back to your goals even. Like that's a step above traditional healthcare right now. But then even on top of that, like if you're seeing someone for shoulder pain, you're basically giving them like a crash course in like how to care for their shoulder going forward. And so really, truly, if they deal with a similar type of issue, they should then feel so like empowered by the education you provided during your care that you're able to then, when they, have a shoulder flare up, that they can be like, okay, I have these tools. Dr. Toni or Dr. Jayson taught me what I needed to know. Let me try this first. 9 times out of 10, going back to the tool set that you gave them and the understanding that they actually achieved of how to take care of their shoulder is going to be, enough. And if it's not, then they have a trusted resource that they can come back to. But that is massively different. I feel like in insurance-based care, it's you're going to make me better. And in cash-based care, it's you're going to teach me how to make myself better, if that makes sense.
Yes, absolutely. It's a completely different mindset. Completely different. We're not even in the same ballpark. We don't even really do the same things, and that's the hard part to explain to people when they're not used to this type of a model. I've got 2 people, and one is planning on having surgery on the 27th. Like it's already scheduled for a hip. And then the other one is he's starting to look into that route. Doesn't look like he needs a shoulder replacement from like my perspective, which is good to have that information and to come from me first is huge,
right?
Because I can educate people on everything that I think is going on, and I've worked with them multiple times. So we spent probably 5 or 6 hours together going through what is specifically going on and bettering his understanding so he can actually make a life-changing decision, which is surgery. It's not something that people should just jump into like it's a tendency.
Yeah.
Because this one in particular, he was in a car crash back in early 2000s. He's had some neurological deficits for a long time on the one side, but when they did his hip surgery, did a total hip on the left side, he's got loss of glute control. So
Oh, wow.
when they actually did the surgery, I don't know exactly if it's a neurological deficit that was, they cut a nerve when they were in there, but things like that happen. They're just not talked about. And so like
Right.
these surgeries, there's life-changing, potentials. Yeah, it could go really good, which is the majority, but the surgeon is not going to talk about those cases that they fudge something up. Like not everybody's the same. And when you start digging people apart with cadavers in school and continuing education, you see the differences in everybody, and there's no possible way that they can see all of those before they start with a scalpel and get in there. So it's one of the biggest things that I have found on this long tangent that I'm on. But one of the biggest things that I've found for these people, because they're coming back to see me, because I educate them and give them their options, and then they make the informed decision.
Right.
That's not what all of the other practitioners do. They say, "Yep, you need a surgery. Yep, we need to crack this joint because it's out of alignment." And it's like that's not care. Like,
no.
Yeah, I could say, "Yep, I need to dry needle this 2 times a day for the next 25 weeks, and I can make absolute bank off of that person."
Yep.
But that's not where research points us most of the time anyways, and the patient needs to have a choice in what they do. And that's what we do, whether it's a young person or an athlete, like a young athlete, or an elderly athlete or active person that just, hey, I want to be proactive with the rest of my life. I see where I'm at now, and I don't want it to get worse. It's like, hey, you're ready, you're in the right spot, let's hit it.
Yeah. And it's cool because in our model again, so you have the time, you have the unique ability to assess in a more complete manner, but then at the end of the day, you also get to make a decision with your patient or your client. And I think that in and of itself is so empowering to people. So we educate and we help them understand, not just what's going on with their shoulder, but it's like, I don't want you to just be able to go home and like tell your spouse like, oh yeah, I have rotator cuff impingement, but I want you to understand what the plan looks like. I want you to understand that the customization of your plan, comes down to how much accountability you need, how much support you feel like you're going to need, how dedicated are you to actually resolving this issue? Because we make plan of care decisions based on that. It's not just, I know your insurance will give me 18 visits, so let's go ahead and schedule you out for 3 days a week for the next 6 weeks. And then hopefully you'll be feeling a little bit better by then. And I mean, we all know good and well that not a lot actually, like you might get some neuromuscular changes in 6 weeks or, definitely some pain relief, but we're not fixing the root cause in 6 weeks. So there's so much that goes into that. And I think it's so different from the traditional healthcare model that people actually feel incorporated into the decision-making process. And it's not just somebody with like Napoleon syndrome with their little white coat on walking around telling you like, this is what you need and we're going to go ahead and schedule it and you'll just figure the rest of it out as it goes forward. Like we're actually taking all of the components of them as a person into consideration when we develop the plan, and then we agree upon the plan before we move forward with it. You know what I mean? And that's just 180 degrees difference from anything else in healthcare.
I think you nailed it right there. That's the breakdown of what we do. And things can change. And it's with the patient, like we don't stick to the same one thing. People are adaptable, things change. Things don't work. So having that feedback from the patient, that's part of how we get people better. Right. And I think you completely nail on the head right there with that final remark there. So I think we tie things up. What other comments do you have moving forward for athletes and just people that are like, hey, I'm ready to take things to the next level. I'm not where I want to be. And I see myself going downhill, like maybe a grandfather or somebody else that you just like, man, I don't want to be in that position because they're so reliant on other people. What kind of remarks do you have for people wanting to move forward with something like what we do?
Yeah. So we just brought on a new clinician at Off the Block, and I was doing some training with him this morning, and this actually came up, so this is perfect. But we were talking about like when your goal is to help someone make a good decision for themselves, when you take the aspect of like, selling them on physical therapy or selling them on cash-based physical therapy, and you just sit down with them and you say, listen, Joe, you have one body, and that is a non-renewable resource. Sure, there are ways in medicine where we can replace your joints and this, that, and the other, but ultimately at the end of the day, you have one body and you have a limited amount of time. Your time on this earth is finite, and both of those things are non-renewable resources. And then there's money, and as much as it does not grow on trees, there is always the opportunity to make more money. And at the end of the day, so that is a renewable resource. So you have to sit down with people and just get real honest with them and say, what is it worth to you when you have one body and only one lifetime to live versus being able to make more money? At the end of the day, is it more important to you that your quality of life and your time on this earth and the one body you get to live it in is taken care of well? Or is it more important that you hold on to every little penny of the money that you're willing to invest? So it's asking people, what is your health worth to you? Because I think, again, at the end of the day, a lot of people are not getting asked that question, and they undervalue their health because there's so many quick fix options out there. So I think my biggest challenge to people who are considering the cash-based or performance PT route or out-of-network care for their care, is it more important to you to be able to save a dime, or is it more important for you to get the best care possible, to live the best life possible, improve your quality of life, improve your movement, and ultimately probably add years to your life? So it's just, what is it worth to you is the big question. And I think people should think long and hard on that question before they make a decision, because I think at the end of the day, you'd be surprised how a lot of people would answer when they're faced with kind of just those two thought processes.
From the Younger You book that I brought up earlier, Dr. Kara Fitzgerald mentions there's 10 diagnoses that like diseases that they looked at in a select number of individuals. There's like 50 something percent that said they have one of these 10 major diseases. So like your COPD, cancer, diabetes, list goes on. And that's 16 of the last years of their life were spent with that disease. And when we think about life expectancy, it's decreasing from the statistics that I've seen in the past. And the quality of life is decreasing way earlier in life. So people are getting these diseases way earlier in life. So the quality of life that they have in the last 15, 16 years, which is greater than retirement years. So people are spending their entire retirement with some sort of disease in the medical system, and it's terrible. We don't think far enough in advance, and my grandpa's a good example. He's been struggling for a while, and he's back in the hospital now, which is really hard to talk about because things aren't looking good.
Right.
And it's so sad because he does have a lot of money. He saved every penny. We bring up change the life for money. He would cash it in, guarantee it.
Yep.
It's like we would love for him to do that too, if that was a possibility. You know, and that's something that people need to think about too, is what would your loved ones say?
Right. They would rather you leave them no inheritance and spend more years with them, more quality time with them in a body that was actually able to help you continue living the life you want any day of the week. So
absolutely. Well, this has been awesome catching up and chatting. We definitely need to do it more often. Give us the information on how people can find you, because you have a podcast too, right?
I do.
I
It's
was
called
wrong,
a
man.
healthy. Yeah, we got 2 episodes with Jayson. It's fantastic. It's called the Healthy HQ podcast. You can find it on Spotify or Apple Podcasts, and several cool episodes. We've got some different health coaches and nutrition coaches, and of course some information with our different therapists, like our pelvic floor PT. So lots to learn there. And then if you're in the local South Carolina area and happen to be listening, you can find us in either Easley or Central, which is near Clemson, or online at offtheblockpt.com. But otherwise, thank you so much for having me on today, Dr. Jayson. Appreciate chatting with you, and hope to catch up again soon.
Absolutely. Thanks for taking the time out of your ever-growing busy days.